Kids are our first priority, so it's not surprising that parents, politicians, and policymakers pay special attention to daycare and early childhood education issues.
Only last month, Charles Pascal, Premier Dalton McGuinty's early learning special advisor, released a report on how to implement full-day kindergarten alongside other education reforms. Pascal suggested that universal public programs will help 3- and 4-year-olds and eventually younger tots with school readiness and better social outcomes. At roughly the same time as Pascal released his report, an American online book was released which suggests the opposite. Reroute the preschool juggernaut argues for targeted programs for disadvantaged children and further suggests that the research on universal preschool programs is mixed, while the cost benefits and long-term societal outcomes are limited. What's a parent to believe?
Standing by at our Queen's Park Bureau is Jane Mercer of the Toronto Coalition for Better Childcare. In Ottawa, Andrea Mrozek of the Institute of Marriage and Family. Now, Andrea, if I read this American report right, it suggests that studies like the Pascal report was politically biased from the get-go. Do you agree with that?
Well, look, the research, parents should know that the research doesn't suggest that the type of program that McGuinty is proposing for all of Ontario is really good for kids in the long term. So the research doesn't bear that out. The second point I would make is that pouring money into a system like that isn't an equitable way of serving parents. Parents would be better off if we were to put that money into their own hands so that they could choose what type of care they would like to use rather than pumping it into a universal institutional form of care.
Jane, we should ask you, do you think the research into the positive aspects of universal early childhood programs is faulty?
No, I don't. We have had more research than any of us can point to over the years telling us that these kind of opportunities for families, for young children in those very early ages reap incredible rewards as they progress through to childhood and adulthood. So no, absolutely. I think that it's an incredibly important step forward to make those kind of services available to families should they choose to take advantage of them.
Jane, I get the feeling that a lot of parents are very confused as to what to do with their young children, which way to go. They talk amongst themselves, oh, this is a great program for my kid, or my kid has special needs, he should go there. Do you find that there's you get a lot of people asking you, boy, well, you know, what's the right way to go, or is there a right way to go?
Well, I think you've hit the nail on the head. Is there a right way to go? Each child is very individual, and so is each family. And what we need to be able to offer them is a range of services that gives family real choices. We talk about wanting families to have choices. We absolutely do. But putting the money into their hands, as Andrea had suggested, is not going to help if the choices are not there. In fact, all that happens is that the money, you know, ends up woefully inadequate for parents to make any real choice. So what we're talking about in this Pascal report, what Charles Pascal has done, and I have to say, it's an incredibly comprehensive report. It doesn't just look at kindergarten. It looks at a system of services for children 0 to 12. They are all intended to have universal access. That does not mean parents have to participate in them all by any means, but it means that those services are there should children and families need them. And it's a very comprehensive system that provides a lot of opportunities for our children and families at all sorts of different paces, families of all sorts of different incomes. So I think it would be a huge step forward for Ontario. And honestly, talking about a step forward, Ontario is so far behind, it's sad.
Andrea, perhaps we should get you in here on this. What is it you expect the government, or would you like the government to do in terms of presenting options to other parents?
Well, first of all, I think that universality, by nature of being universal, can't offer those choices that Jane speaks of. It's one provider, it's a government provider, and the money goes into one source. So I think intuitively we know that that isn't actually providing numerous different options. It's a cookie-cutter approach for our very youngest 3- and 4-year-olds. If we could look at something like money for families in amounts that would really help them to make choices, if we could loosen up the market on that type of, on the existing patchwork of care, this patchwork is beneficial. This is how parents are able to make different choices. And parents actually say, when they're asked, how would you prefer your children be cared for, they don't say institutional care based in a school for their 3-year-olds. They suggest that a spouse or a family member is best able to provide that sort of thing. So we really should be looking at public policy that supports parents where they're at with their desires, instead of funneling money into a system that we know in Quebec the costs skyrocket, our taxes will go up, and quality has also been proven in Quebec to be mediocre. We have an example of this type of system in Canada, and it hasn't proven to be particularly effective at all.
Okay, Andrea, is there a model out there that you think Ontario should follow? There's a system that works beautifully, and the response has been excellent from parents, and enough research has been done so that we can follow some of these kids who participated in this in the early years and are now flourishing?
You know, that's a very, very good question, and I basically always point to the fact that research is mixed and outcomes are mixed. There's no universal consensus on a massive universal program being the way to go. So basically, we need to look at a myriad of different options and assess what might work, leaving the control and the power in the hands of parents. That comes through giving them money if need be. It doesn't come through universal systems.
But the one thing I don't understand, and Jane, you can pipe in on this, if the universal systems are in fact not what people want, why are they so crowded? People obviously are taking their kids there.
I think that we can't speak only of a universal system of services. Like with the healthcare, you know, we know that we need a universal access to a good healthcare system for all. But that isn't the only thing we need to do for our health. People need to eat well, they need to have the opportunity to exercise, they need to have clean air. So we know that just providing the system, the service of services, isn't the only thing we need to provide. And I think Andrea has spoken about giving parents money, and certainly you know, I would totally agree that parents need income support. A lot of our parents, families in Toronto, we have 1 in 3 children living below the poverty line. That is absolutely atrocious for a city of this size in this country. And we have to do things in the way of child benefits to support families. But again, that is not instead of a system of services. Families need services and they need income support. And we have to take care of our children and our families in those very early years. And we have to do it soon because they grow up so fast. So I would say we're not talking services instead of other supports. The Pascal report refers to extended maternity leave. It talks about Best Start child and family centers. It isn't just a kindergarten. It's an extended day for families that are working so that they can have their children, they have the option of having their children in a supervised, regulated, high-quality early learning setting whilst they're at work. Many, many families, the long waiting lists in Toronto tell us that that's what families want. We have 70% of our mothers of young children are in the workforce. That's a reality. And with 1 in 3 children living below the poverty line, that's a reality that many of our families have no choice about. They have to work. They frequently have to work 2 or 3 jobs to support their families, which is ridiculous. Right. So we need to give them a supportive service so that they only have to work 1 job, so that they can be there for their children in the way that we need them to support them in other ways.
Well said. Jane Mercer in Toronto, Andrea Mrozek in Ottawa, thank you both for joining us. We really appreciate your expertise.
Thank you. Thank you very much.